This treatment combination, because it does still involve a low dose of chemotherapy, does cause a moderate amount of suppression of the bone marrow. So patients will have very low neutrophil counts and low platelet counts, particularly in the first 3 to 4 weeks of treatment. But what we've found is that because of the very high rate of leukemia clearance from the bone marrow and the high remission rates which are achieved, most patients recover their blood counts after 1 month of treatment, and then they continue to have much healthier blood counts from there, and subsequent treatments are associated with much briefer periods of low blood counts. And just the fact that we're clearing the bone marrow of leukemia in the first month in a much higher proportion than we have historically, this really has a huge impact on patients because for the first time we're getting a high remission rate in older patients with leukemia, and patients who have their bone marrow cleared of leukemia really have a much better quality of life. They don't have the consequences of infections and bleeding that other patients do who don't achieve remission. It's just commenced, and obviously many phase 3 studies are quite sizable, so all I can say is at this stage is that it will be at least a few years before we have top-line results from a trial of this size.